Hello everyone. Thank you for being in today's video. When entering the age of 40 to 50, there's a story almost everyone has heard. Joint pain, aching knees, and creaking sounds when standing up or sitting down. And almost immediately, the name glucosamine appears in advertisements, prescriptions, and recommendations from friends or health supplement sellers. But have you ever wondered what glucosamine is? Why is it so heavily promoted? Does it really work for joint cartilage, or is it just a hyped-up health trend? In this video, we will scientifically, objectively, and clearly analyze glucosamine from its chemical structure and biological role to clinical evidence and common misconceptions that lead many people to believe it's a miracle cure for middle age. Glucosamine is a naturally occurring compound in your body, especially in joint fluid and cartilage structure. Chemically, it is an amino acid that serves as a building block for the synthesis of large molecules called glycosaminoglycans, the main components in cartilage tissue and synovial fluid. In other words, glucosamine is like the foundation brick in the construction of joint cartilage. When you're young, your body produces enough glucosamine to maintain healthy, flexible cartilage. But as you age, your body's ability to synthesize this substance gradually decreases, making cartilage more susceptible to wear and tear and damage, especially in the knees, hips, and spine. Therefore, the hypothesis is that supplementation is necessary. Can externally administered glucosamine help compensate for internal deficiencies, thereby protecting or even regenerating joint cartilage? Since the late 1990s, glucosamine has appeared in the functional food market, initially in Europe, then spreading to North America and Asia. With the slogan, "Nourishing joint cartilage from within," glucosamine quickly became one of the most widely used joint supplements in the world. In Vietnam, the glucosamine market boomed after 2010. A series of imported and domestic products emerged in tablet and powder form, combined with chromium, MSM, or collagen, targeting middle-aged and elderly people, as well as athletes. According to statistics from the United States, more than 10% of people over 50 are using glucosamine regularly, even though most do not have a specific medical diagnosis. This shows the strong influence of media, advertising, and the psychological tendency to take it for preventative purposes. However, the question is whether glucosamine supplementation is truly as effective as advertised. Or are we using a product based more on belief than evidence? And if it is effective, to what extent? Is it enough to reduce pain and aid recovery? Is it just cartilage repair or mild support? Another important point is that glucosamine isn't just one type on the market today. The two most common forms are the following: glucosamine sulfate, which is more extensively studied and often found in high-quality products, and glucosamine hydrochloride, which is cheaper and easier to produce, but whose pharmacological effects in studies are less clear. This distinction is crucial because many studies make mistakes by not differentiating between the two, leading to conflicting results and confusing consumers. Finally, remember that glucosamine is not a cure. It doesn't regenerate lost cartilage, and it's not a replacement for treatment of arthritis or severe damage. It can only be considered part of a joint protection strategy if used correctly, in the right form, and at the right dosage. In the next section, we'll delve into the biological mechanisms. Why doesn't joint cartilage regenerate itself? And what actually causes joint pain beyond simply worn cartilage? Second, the biological mechanisms of cartilage and osteoarthritis. To understand the role of glucosamine, we need to understand the mechanism of joint function, especially articular cartilage, where it directly affects joints. Joints are susceptible to damage during the degenerative process. A joint is where two bone ends meet, allowing for smooth and painless movement. Each bone end is covered by a layer of articular cartilage, a special connective tissue that is soft, smooth, and elastic. Cartilage has no blood vessels or nerves. This means it doesn't nourish itself and doesn't cause pain. Therefore, you may not feel minor damage until it's discovered, at which point the damage has progressed. Why is cartilage so important? Because cartilage helps absorb compressive forces when you walk, stand, climb stairs, or carry heavy objects. It's like a soft rubber cushion between the two bone ends. When cartilage thins, wears down, or cracks, the bones rub against each other, causing inflammation, pain, and limited movement. Cartilage is mainly composed of water, collagen type and matrix substances such as glycosaminoglycans, and this is where glucosamine plays its role. Glucosamine is a precursor that helps the body synthesize collagen, which forms the matrix of cartilage and synovial fluid. However, cartilage has one characteristic that makes it more vulnerable to damage than other tissues. Cartilage does not have a direct blood supply. Nutrients enter the cartilage through synovial fluid and the compression and release of movement. When you are inactive, have poor circulation, or the cartilage is already damaged, nourishment and cartilage regeneration are almost non-existent. In other words, once cartilage degenerates, it is very difficult to completely restore it. This is why experts often emphasize prevention and preservation rather than waiting for it to wear down before treating it. Interestingly, joint pain doesn't come from the cartilage itself. Because cartilage lacks nerves, it's the surrounding areas such as the synovial membrane, ligaments, joint capsule, and subchondral bone that send signals. When cartilage wears down, the underlying bone bears more weight, causing inflammation, swelling, and increased pressure, and that's what causes pain, stiffness, and limited mobility. Some people think, I hear a creaking sound. I must be experiencing cartilage wear. This may be true, but creaking doesn't always mean serious disease. It's a sign of abnormal friction between the joint components. This can be due to many factors such as decreased synovial fluid, tendons pulling out of alignment, or simply a loss of smoothness on the cartilage surface. It's worth noting that cartilage degeneration occurs silently over many years. Many people only realize they have osteoarthritis when they experience pain, but in reality, the cartilage has been gradually wearing away for 5 to 10 years prior. A study in Japan showed that in a group of people over 60 years old with no symptoms, in fact, up to 40% of patients showed signs of osteoarthritis on X-rays even without experiencing pain. This indicates that cartilage damage doesn't necessarily translate to immediate pain, and conversely, pain doesn't always reflect the severity of osteoarthritis. Because of this insidious process, glucosamine and other joint supplements are often recommended for early use before damage becomes too apparent. But does taking glucosamine really slow down cartilage wear, restore damaged tissue to some extent, or only provide temporary pain relief? In the following section, we will delve into the most important part, summarizing major studies on glucosamine, its actual effectiveness, and should we expect cartilage regeneration as advertised. Third, glucosamine. What does the research say? Glucosamine has been widely used for nearly 3 decades and is one of the most popular active ingredients in the joint supplement group. But as with many other fields of medicine, the crucial question isn't how many people use it, but what the science says. The answer isn't simple. Some studies suggest that glucosamine is effective in reducing mild pain in osteoarthritis, especially in the knee. However, other studies have shown no such effect. This was significantly different from placebo. To answer this question comprehensively, scientists conducted numerous meta-analyses, which involved assembling and reanalyzing dozens of smaller studies with thousands of patients to arrive at more reliable conclusions. One of the most frequently cited analyses is from the Ken Foundation, an independent international organization specializing in the evaluation of medical evidence. According to the latest update, Cochrane stated that non-hydrochloride glucosamine sulfate may help alleviate knee joint pain in some patients, especially when taken regularly for over 3 months. This effect is significantly stronger than placebo, but not everyone responds. There is no clear evidence that glucosamine can regenerate cartilage or slow down degeneration on imaging. Another analysis in the New England Journal of Medicine evaluated glucosamine hydrochloride alone or in combination with chondroitin in over 1,500 patients. The results showed that the glucosamine group did not experience greater pain relief than the placebo group in most patients. However, in the group with more severe degeneration, some individuals showed subjective improvement. The results are noticeable, with low side effects and good tolerability. This leads to an important conclusion. The form of glucosamine you use is the determining factor. Glucosamine sulfate, especially the form stabilized with potassium or sodium salts, yields more positive results. Glucosamine hydrochloride, more common in cheaper products, has less noticeable effects. Additionally, the duration of use also affects effectiveness. Glucosamine does not have an acute pain-relieving effect like anti-inflammatory drugs. It needs time to accumulate and exert its effect, usually 4 to 12 weeks. If you take it for a few days and then stop because you don't see results, that's normal because it's not a fast-acting pain reliever. It's worth noting that some manufacturers often cite studies with good results, but don't specify which form of glucosamine is used, the dosage, or any combinations. This can easily mislead users and lead to unrealistic expectations. Currently, international recommendations from organizations such as the European Rheumatology Association, EUR, and the International Osteoarthritis Society, ORS, consider glucosamine sulfate a reasonable option for people with mild to moderate osteoarthritis, but it is not mandatory. This means it can be used if appropriate, but not necessarily. It should be considered the only solution. In short, glucosamine can help reduce mild to moderate pain, especially when used in the correct sulfate form and at the correct dose of 500 daily. There is no clear evidence for cartilage regeneration or joint tissue repair. The effect is individual. Some people feel a significant difference, while others see no change. It is not a substitute for prescribed medication if you have severe osteoarthritis, significant inflammation, or joint deformity. So, who should consider using glucosamine and who should be cautious? In the next section, we will explore in more detail the suitable candidates, potential side effects, and interactions to be aware of if you are taking other medications. Fourth, who should and shouldn't use glucosamine? From what we have analyzed, it can be seen that glucosamine is not a miracle cure for all cases of joint pain. However, it still plays a certain role if used correctly, in the right way, and at the right time. So, who is a suitable candidate to consider using glucosamine? It is most suitable for individuals with mild to moderate signs of knee osteoarthritis, diagnosed clinically or imagingly, experiencing dull pain, crackling, and morning stiffness, but without other symptoms. Those with joint deformities, who do not want or do not yet need regular anti-inflammatory medication, have no previous adverse reactions to glucosamine, and are willing to use it regularly for at least 8 to 12 weeks to assess its effectiveness. For this group, glucosamine can help reduce mild pain, improve joint lubrication, support synovial fluid biosynthesis, and thus improve quality of life. However, maintaining physical activity, losing weight if needed, eating a balanced diet, and regular monitoring are still necessary. Glucosamine should not be considered the only treatment. Who should not use it or should be cautious? 1. People with seafood allergies. Because most glucosamine is produced from shrimp, crab, and shellfish shells, caution is needed for people with shellfish allergies. Although the risk of reaction is low because the protein has been removed, it is still advisable to consult a doctor if there is a history of allergies. 2. People with diabetes or insulin resistance. Glucosamine has a structure similar to sugar, and some studies have noted that it may have a slight effect on blood sugar control, especially with long-term use. People with type 1 diabetes or metabolic syndrome should check their blood sugar regularly while using it, although the overall risk is low. Thirdly, people who are taking anticoagulants such as warfarin. Some reports suggest that glucosamine may increase the effects of anticoagulants, prolonging bleeding time. If you are taking this medication, consult your doctor before supplementing. 4. There is insufficient evidence regarding the safety of glucosamine for pregnant and breastfeeding women, so it is not recommended for use in pregnant or breastfeeding women unless specifically prescribed by a doctor. 5. People with severe liver or kidney disease. Although glucosamine is excreted in the urine at commonly used doses, it does not cause significant liver or kidney toxicity. However, if you have chronic kidney or liver failure, you should be cautious with any dietary supplement, including those with other health supplements. Notes on using the usual dose of 1,500 milligrams glucosamine sulfate daily, divided into 1 to 3 doses. The more effective form, glucosamine sulfate, is of pharmaceutical origin, not the hydrochloride found in cheaper dietary supplements. It should not be used intermittently to be effective. It should be used regularly for at least 8 to 12 weeks before evaluating its effectiveness. In combination, glucosamine can be combined with chondroitin, MSM, or omega-3s, but avoid using too many active ingredients at once without consultation. A study in Canada, showed that among over 1,000 patients with osteoarthritis of the knee who used glucosamine for 3 months, nearly 40% experienced significant improvement in pain levels and mobility. The remaining 60% either showed no significant improvement or stopped treatment due to lack of effectiveness. This indicates that effectiveness depends heavily on individual constitution, disease stage, and user expectations. In short, glucosamine may be helpful, but it's not for everyone. If you're looking for a comprehensive solution for your joints, taking only supplements isn't enough. In the final section, we'll answer the most important question. If you're not using glucosamine, or if you are, but still want long-lasting joint health, what is the solid foundation you need to invest in? 5th, what is the real foundation for maintaining healthy joints? Whether you're using glucosamine or not, one thing is certain. Supplements cannot replace the fundamental elements that contribute to lifelong joint health. Articular cartilage and surrounding structures do not exist independently. They are part of a system that includes bones, muscles, ligaments, joints, synovial fluid, and the nervous system that controls movement. Focusing solely on a single pill or supplement while neglecting other factors is not advisable. Through the roles of exercise, weight, diet, and recovery, you are weakening the complex biological system that is capable of protecting itself. So what is the real foundation for keeping joints healthy? Maintain a healthy weight. Each kilogram of excess weight triples the pressure on your knee joints when you walk. If you are 5 to 10 kg overweight, your knee joints are bearing tens of tons of extra force every day. Losing just 5% of your body weight has been shown to significantly reduce joint pain, improve mobility, and eliminate the need for additional medication. 2nd, exercise correctly. Joints need to be used but not overloaded. Regular light resistance training helps increase muscle strength in the joints, reduces pressure on cartilage, and prevents deformities. Typical exercises include sitting down and standing up from an armless chair, stationary cycling, swimming, water walking, balance exercises, and stretching the muscles around the knees and hips. It's important to exercise regularly, not waiting until you feel pain. A study from Stanford University showed that people who did light resistance training 3 times a week for 12 weeks improved knee cartilage thickness and reduced synovial inflammation. 3rd, sleep and recovery. Lack of sleep increases the inflammatory response and reduces the quality of tissue regeneration, including cartilage tissue. Get enough sleep, ideally 7 hours a day. By 8 p.m., avoid using painkillers at night unless necessary. Your body heals best while resting, not while you seek additional medication. 4th, eat an anti-inflammatory diet. A diet rich in vegetables, healthy omega-3 fats, and antioxidants will help limit chronic inflammation around the joints, reduce collagen breakdown, and provide nutrients to connective tissue and cartilage. You don't need to completely eliminate carbohydrates, but you should reduce simple sugars and processed foods as they promote inflammation and weight gain, 2 of the biggest enemies of joints. 5th, be patient and observe your body. No pill will cure your joints in a few days. Whether it's glucosamine, chondroitin, or any other product, you need at least 2 to 3 months to honestly assess its effectiveness. Also, listen to your body. Pain increases after sitting for long periods, you feel tired when climbing stairs, and you can't bend your knees as before. These are all signs that your joints need proactive early intervention. Don't wait until inflammation is severe and deformity occurs before you start worrying. Glucosamine can be a supportive measure, but it's never the sole foundation for maintaining healthy joints. Strong joints are achieved by maintaining a healthy weight and exercising regularly. Regular and proper exercise, sufficient sleep and good recovery, and an anti-inflammatory diet are essential. Be patient in monitoring progress instead of relying solely on immediate feelings. You can't avoid time, but you can certainly slow down the degeneration process and, more importantly, maintain your proactive abilities, flexibility, and quality of life. If today's content helped you better understand glucosamine and how to comprehensively care for your joints, please like, subscribe to the channel, and leave a comment. How old are you? What joint problems are you experiencing? I will continue to create easy-to-understand, scientifically based videos so you always understand what your body needs.